So now with the COVID-19 pandemic and social isolation, sleep may be even more of a challenge. How can patients and survivors make sure they get sleep and stay healthy?
Yeah, I think that probably my advice to survivors wouldn't be our patients with cancer wouldn't be a lot different than the general public. Good sleep hygiene measures are always going to be good to help stave off insomnia, and those are a little more difficult when we're doing things like self isolation. So things like having a schedule and sticking to it. Well, when you don't ever leave your house, it's hard to get a schedule that feels very real. But there's some important things that we can do. Get up in the morning at a reasonable time. At some point, get dressed, be physically active, eat your 3 meals a day. Have some structure to your life can really help, and that also helps keep things like anxiety down.
Mm.
Um, the other piece I think I would give advice to really anyone is to really limit the amount of time you are interfacing with what's stressing you. A really good example of that is we could spend 24 hours a day either watching media or reading media about the pandemic. I think people fall into two categories. Some people, they want to know everything possibly they can know about something, and that kind of brings their anxiety level down. But there are just as many people that the more they watch, the more anxious they get. So if you know you're one of those people that by the time you get to the end of a television interview with someone, you're feeling more anxious, well, then limit. 1 hour a day. You can probably get all you really need to know about keeping yourself healthy and what's going on in the bigger world by maybe 1 hour a day of really selective media that doesn't stress you out.